The medically compromised patient. So what do we have here? We have five categories. First is the cardiovascular diseases, then the respiratory diseases, then liver disease, pregnancy, and neurological disorders. Under the cardiovascular diseases, first is the hypertension. Second is the ischemic heart disease. Then the thromboembolic disorders or the patients na nagatake ng anticoagulants. Then under the respiratory diseases, first is the asthma. Then the COPD, chronic obstructive pulmonary disease. Under naman sa liver disease is the viral hepatitis. Epilepsy under the neurological disorders. In cases where the patient has not been seen by a physician within the past several months, screening laboratory tests should be conducted. Dental management can be complicated since any procedure causing stress can further increase blood pressure. Dental management. Minimize stress levels. Second, avoid local anesthetic solutions containing adrenaline, since adrenaline is a cardiac stimulant. Next sa CVS or cardiovascular, ischemic heart disease. There are two principal clinical manifestations ng ischemic heart disease. First is the angina pectoris. Angina pectoris is chest pain, particularly when exerting effort, relieved by rest and nitroglycerin medication. Yung pangalawa is myocardial infarction. This is persistent and severe na chest pain more than 30 minutes. Cannot be relieved by rest and nitroglycerin medication. So, sa dental management ng ischemic heart disease, get the vital signs before treating the patient or pre-treatment vital signs. Then avoid dental extractions for patient who had a myocardial infarction within 6 months. Last, under the cardiovascular or CVS, thromboembolic disorders. Patients too unstable to cease anticoagulant therapy, for example, yung mga patients who had undergone prosthetic valve replacements, they require lifetime anticoagulant therapy. These patients are best treated in hospital, where they are placed on intravenous heparin once warfarin is stopped. Asthma. Patients are instructed to bring their usual medication or inhaler for every appointment and keep it available. Prophylactic inhalation of patient's bronchodilator at the beginning of appointment is a valuable method of preventing asthmatic attack. Use of pulse oximeter is valuable for determining oxygen saturation of the patient. A drop below 90% indicated poor oxygen exchange and the need for intervention. COPD. Avoid dental treatment if upper respiratory infection is present. Treat the patient in upright chair position or semi-supine. Avoid use of rubber dam in severe disease. Dental management ng viral hepatitis. No dental treatment other than urgent one should be given to patients with active hepatitis. So sa pregnancy naman, dental x-rays should be avoided, especially during first trimester of pregnancy, because of the possibility of fetal abnormality. The second trimester is the safest period to provide routine dental treatment. Dental extractions are best performed in the second trimester. When using local anesthetic, avoid prilocaine and octapressin. Because of risk of hypoxia, extractions are performed with the patient semi-reclining or sitting upright. Any drug that is respiratory depressant can cause maternal hypoxia, resulting in fetal hypoxia, injury, and death. Ideally, no drug should be given during pregnancy, especially during first trimester. The concern is that the administered drug can enter the breast milk of and be transferred to the infant, resulting in adverse effects. In addition to careful drug selection, nursing mother may take the drug immediately after breastfeeding and avoid nursing for 4 hours or more. Seizure generally does not last for more than a few minutes. In a few minutes, the patient will gradually regain consciousness but may be confused or disoriented. Dental management of epilepsy. No further dental treatment is attempted after a seizure. If the seizure is prolonged status epilepticus, or if repeated, intravenous diazepam of 10 mg or lorazepam, which is 4 to 8 mg, is used to control it.